Hi, I'm Phil. Today we're going to look at how to take blood from a patient or venipuncture. So like any good procedure, we need to have good preparation before we go in, because you only have two hands, and once you have a needle in someone's vein, you're going to be all fingers and thumbs and not be able to grab stuff. So have it all prepared, ready to go before you start. So how do we do this? What do we need? So firstly, explain to the patient what you are going to do to them, and also check the patient details. You don't want to be taking blood from one patient that was meant for another. Okay, so make sure you check the name and date of birth and that you have the right patient. Then we want to check the site. We want to look where would be a good site, and also ask the patient if they've had blood a few times. They go, oh, they never could get it there, they could only get it on the right arm, not the left arm. Oh, they tried in the back of the hand and it always fails and it hurts a lot. So, you know, get a bit of information from them, because they can guide you. It's their body, they know where blood's been taken before, and that will assist you to have a successful venipuncture. Once you've assessed where you're going to go, put on the tourniquet. Some people do a fist pump just to engorge the veins. I like to give them a massage and a bit of a talk, and I actually talk to the patient about something else irrelevant, or something relating to them, because a bit of distraction therapy helps. When they fixate on the arm, they tense up, they can move, and you'll find that your success rate will decrease. So have a chat about something else, like what they do, something that will keep them talking for a couple of minutes. Once you've found your place you want to take the blood, you also got to consider where you are taking it. So if you found the place in the elbow and you go, oh, that's nice, make sure that it's not all nodular and knotty under there. So if they've had previous venipunctures, if it feels all fibrosis and hard, you've probably got a decreased chance of actually getting in the vein. It's just a big fibrous lump there. Also look for skin condition. Make sure you don't go near a broken area or area that's bruised. If they have fragile skin, just be careful when you do put pressure in that you don't cause a skin tear or any subcutaneous hematomas. The other thing to consider is the onlooker. The friend or relative that is standing in the room. I always say, are you comfortable while I do this in front of you? You're going to pass out or anything? Because I've had no end of time where I've gone to put the needle in, started taking blood, and you hear a thump. Now, because you're accessing a vein, it's not like you can suddenly go and attend to the person that's passed out on the floor. You have to actually finish taking the blood, occlude the area, dispose of a sharp, and then go help. So to bypass that, I either tell the person, relative, to sit down in a chair, or can they step out for a couple of minutes while we do this, and then we'll call you back when it's all finished. And that usually alleviates most problems. And also the relative or friend gets embarrassed when they've passed out because they've seen blood and everyone picks on them. So what equipment do we need to prepare? We need something to access the vein, so we need a needle or a butterfly to access. We need to cleanse the skin around the area because of all the bacteria, so we need to have preferably a 2% chlorhexidine wipe, or you can use an alcohol wipe, but you need to allow the area to dry for 30 seconds before you put the needle in. Either have a syringe, or some pathology companies have containers, little blood containers that will aspirate the blood out for you to the appropriate level. You can use that sort of equipment too, depending what you're doing, accessing the blood for. So what do we do? So we've already prepared our area, we've seen where we want to go. I open up all my equipment and have it in front of me ready. Put your PPE on, so your gloves, gown, and goggles, so you don't get any splashes. Have it all set up, and then I re-tourniquet the arm. So I don't tourniquet for more than probably a minute, minute and a half. Find where I like the vein the best, where I had the best chance of accessing. Cleanse the area, starting in a small circle motion, working my way out to about 2.5–3 centimeters around the area. Let it dry quickly, then to insert the needle, you don't just jab it straight in. I actually have the bevel facing up. There's a little beveled edge. Have it facing up, push it just on the skin, just on top of the vein, and gently insert, because the bevel will actually cut down into the vein for you, so you don't have to push too hard. And then wait for flashback to either come up the needle into the little coloured end, or if it's a butterfly, a bit of flashback should come up the tubing. That's when you know you're in the vein. Once you've received that, pushing just a little bit further, just the head width of the bevel, so you're only talking a couple of mil, just to make sure you're in and secure. If you're using a butterfly, you might want to put a bit of tape over it to secure it in position, and then aspirate the blood out as needed. Also, remember, if someone has fragile or delicate skin, you might need to put your hand underneath and just pull the skin gently tight so your vein doesn't roll around or wiggle away from you, and then aspirate your sample. Once your sample is aspirated and you need to remove the needle, have your cotton bud or special dressing ready over the site. Remove the needle, watch a little bit of blood come up, and then put pressure on it. You don't want to put pressure on as you're pulling out the needle, because that is a cutting blade still and you can damage the vein. So make sure the needle's out before you put pressure on. Then dispose of your sharp appropriately, and then we go on to label our bloods. Make sure you've got the correct name, date of birth, and never leave your bloods out of your site. So once you've taken them, don't go put them down somewhere, go do another job, come back, label them, because who knows what's happened to that blood. You cannot 100% say, yeah, they're my bloods that I've sent off. So for safety reasons, for your own safety, make sure you label the bloods as you've taken them. So once you've labelled your bloods and you've pulled out the cannula, explain to the patient some post-venipuncture care. So just say to them, keep pressure on there for a couple of minutes to prevent bleeding. If it's in a joint, say don't move your elbow or wrist for too much for the next hour or so, just till the bleeding settles. If they've got a history of bleeding problems, they might need to put pressure on a bit longer. If they're an outpatient and going home and you say they've got post-venipuncture bleed at home, say put pressure on it for a few minutes. If it hasn't stopped, come back and be seen again. So with venipuncture, you need to do perfect practice. It's not just practice, you need to have a good technique to start with, to do good practice, and then you'll become more competent at it. If you want to practice on a few things, a good few tips to help you learn, if you don't have a fake arm to use, is either get a bit of soft macaroni that's got a hole, because that feels the same and it wobbles around. Try and insert a needle into that. Or if you've got a little bit of rubber tubing, thin rubber tubing, put it underneath a bit of like cling wrap on a little board, and it will wobble around for you nicely, so you can compress the cling wrap and try and insert the needle. And it's all about the technique, just trying to get that right. So I hope that helps you guys get a bit more successful with venipunctures, and look forward to seeing you. Take care.